I'm Margaret Ridley, and I'm chair of the Cambridge branch of NHS College. And my first duty is to discuss health and safety matters and to explain where the 3 fire exits are. So one fire exit is through the main entrance when you came in, another fire exit is through that door there, and then the third fire exit is through that door there. And I hope we won't need to avail ourselves of the fire exits. I would like to welcome you to our NHS election Hustings, and a very warm welcome to our parliamentary candidates. Catherine O'Flynn from the UK party is not able to be with us tonight. A recent morning opinion poll put the NHS as a topic of most concern to the voters. We therefore want to have a maximum time for questions from the audience and clear answers from the candidates, so that people can go away knowing exactly what each party intends to do about the NHS in the next parliament. The campaign strategy for the evening is that I will begin with a brief introduction to keep our NHS covered. I will then ask the candidates to introduce themselves and give a 2-minute statement on their position on the current state of the NHS. We will then move on to questions to the candidates that are being submitted either onto our website or by the questions that are being circulated tonight. So if anyone else has got any questions that you'd like to do, so if you'd like to put in and come to the front desk. The candidates will be invited to respond in turn, and we're asking for a time limit. In the information session candidates, we do say 3 minutes, but we've got so many questions. I'm wondering if you're going to be able to stick to 2 minutes, because we want to get through, as I said, as many questions as possible. Now our timekeeper is sitting on the front row, and she will indicate with the finger that we've got 1 minute left, and then once time is up, she will do that. After the candidates have spoken, we'll then ask whether the question, that person who put the question would like to make any comments, and then whether people in the audience would like to make any comments about the candidate's response. I would like to ask that we respect each other's points of view and that we do not shout at or interrupt each other. If you'd like to make a comment, please raise your hand. Now, Keep Our NHS Covered is a national organisation that was set up in 2005 during the Labour government, when it became clear that Labour was continuing the internal market, PFI and privatisation agenda that had been started under the previous Conservative government. Keep Our NHS Covered is not aligned to any political party. The Cambridge branch of Keep Our NHS Covered was founded in 2012 in response to a further threat to our NHS posed by the Health and Social Care Act of 2012, which was passed by the coalition government. This has resulted in all the contracts within the NHS being put out to competitive tender, with over half of them being awarded to private for-profit companies. Members of the Cambridge branch consist of people from many different backgrounds, including current and retired health workers and members of the public, all of whom believe passionately in the founding principles of the NHS, that it should be publicly provided, publicly accountable and funded through general taxation. We have been campaigning on local issues, opposing the temporary contracts in the elderly services and the GP out-of-hours service in Cambridgeshire, and supporting the hands-off pension book campaign. We've also campaigned on national issues, including supporting the NHS Reinstatement Bill 2015, which is about renationalising the health service. We would like all candidates to support our pledges to the NHS, which have been placed on your seats and on the desks in front of the candidates. I would like the candidates now to introduce themselves and give a 2-minute statement on their position on the current state of the NHS. So we're going to start off on my far right, so if you would like to start.
Margaret, thank you, and thank you everybody for coming to this very important Hustings here this evening. So I'm Rupert Reed, I'm the Green Party candidate for Parliament for Cambridge. And the Green Party stance on the question that is before us this evening is straightforward. We've got a little visual aid here. Keep the NHS public. There it is, black and white. You can't say fairer than that. And in many ways, it really is that simple. Although actually, unfortunately, it has recently become a bit more complicated for the very reason that Margaret just gave. There is a serious question about whether we have the NHS as a public service anymore. Is it a question of keeping our NHS public? Or is it a question of returning our NHS to public ownership? As it now is very clearly with the railways, and increasingly respected opinion suggests that it is for the NHS too. That's why we have the NHS reinstatement bill, which of course was sponsored by our MP, the brilliant Caroline Lucas. I want to become your MP so that I can back that bill and back other important measures, including taking the railway back in public ownership and the other things I can talk with you about. And I want to suggest to you that there is a pretty stark choice facing you this evening. I'm sure that many of you are aware of the serious problems that the coalition policies have brought in this area. But what I really want to emphasise in the short time I have right here and now to get us started is that it is a grave error to think that Labour is in any position to address those problems. It is Labour, as Margaret said, that brought in many of these things and have brought the NHS to the path that it is in, including very strikingly the PFI and incremental privatisation of parts of the NHS. If you want to keep our NHS public, or if, more precisely, you want to return our NHS to full public ownership, there is one choice at this election which will do that. That is the Green Party. I hope to have more opportunity to elaborate on that with you during this evening, to talk with you also about very important other aspects of the matter, including the importance of prevention and general health. That's the fundamental proposition. The Green Party is the only choice to keep, or rather, to make our NHS public.
Thank you very much. It's great to see so many people here for, I think, one of the key issues we're going to talk about. The NHS is a great institution. It was a brainchild of a brilliant Liberal Beveridge, implemented very well by the Labour Party after the Second World War. It is quite rightly the envy of much of the world. And it absolutely should be there for us, free at the point of use. It is an essential thing to have, and I absolutely agree. And there is a real problem. The private sector has a very different ethos, a very different attitude, which is why I have campaigned to make sure that we are a public NHS. But it's worth looking at what has happened. Rupert's absolutely right, Margaret was absolutely right. We have a long history of it becoming less and less public. In 1997, when Labour took over, there was £1.1 billion a year spent buying in private medical care. By the time Labour left office, it was £7.5 billion. This government has, I regret to say, continued to extend that. Actually, at about the same rate that Labour did. The problems started there. And the PFI contracts that sucked money out, Labour's system where private providers got paid more than the public sector did. That is wrong, and that has caused us huge problems. I voted against Andrew Lansley's bill at the third reading. We'll talk about other stages in the process, I'm sure. And I campaigned very hard for the Older People's Contract to stay with us. And when Labour had put out Hinchinbrook to the private sector for tender, I campaigned for it to go back into the public sector. That's the right thing to do. We do face some choices. We have to get money. The Chief Executive of NHS England says we need £8 billion by 2020. We are the only party that has said we'll do that and said how we'll pay for it. Labour say they won't do it, the Tories won't say how they pay for it. We've also pushed for the thing that never gets talked about, which is mental health. Mental health is an essential part of this. I'm really proud to be pushy on that, getting more money in. As to our commitment, we should have no more large structural reform, we should have much more localist control, and even look at ending the Commissioner Provider split. And lastly, I voted for the NHS Amended Duties and Powers Bill, which does almost exactly the same as the NHS Reinstatement Bill. We'll be quite happy to vote for that as well as your MP again. Thank you.
Thank you very much. Good evening, ladies and gentlemen. My name is Chamali Fernando, and I'm 36 years old. I've been a barrister for the last 12 years and practiced in a variety of areas of law, representing people from all walks of life, those facing loss of their job, loss of their home, collapse of their business, or even facing jail. I'm also a policy advisor to set up an international court for the environment, and one of my other hats is that I am a Some of you who will have had the chance to read my literature will be aware that I am the daughter of a midwife. My mother worked for the NHS from 1967 to 1987, when it really was the enemy of the world. And we have still got dedicated healthcare professionals, and I'd like to take the opportunity to say thanks to all of those people who have either looked after me or looked after anyone in this nation. Because most people, when they have experienced the NHS, have been very grateful for the services that they have received. I believe that we need to get serious about prevention in the NHS, empower patients and give them the choice over patient care. Under this government, the 5-year forward review has just recently been published, which details experiences within the NHS and also where we hope to be with the NHS in years to come. On Sunday, George Osborne actually confirmed the pledge to commit £8 billion per annum to the NHS. We have already, in the autumn statement, announced a £2 billion pledge to the NHS, which we have calculated from our deficit funding. However, the £8 billion, where are we going to get the money from? And this is the difference between myself and any of the candidates on this panel. The pledge I make to you is costed and is deliverable, and it won't be subject to a coalition agreement such as tuition fees and then, oh dear, we dropped on that promise. So, in terms of where we're funding it, more jobs, 1,000 jobs are created every day, and more taxes raised from businesses, new businesses starting up every day. Ladies and gentlemen, I hope we get the chance to talk about more of this in detail, but the key thing is continuing to protect an NHS that's free at the point of delivery.
Good evening, everybody. I'm Daniel Zeishan. I'm Labour's candidate for Cambridge. The NHS is my passion. My day job is working for Unison, which is a trade union which represents many people who work in the National Health Service. 5 years ago, Julian and I did a similar set of hustings, and I remember one evening saying, why don't we have any on the NHS? At St Bede's, at the end of it, I said, does anyone want to talk about the NHS? Ask about the NHS. You know what? No one was talking about it. The reason? The hard work that had been put in by staff had transformed the NHS. It wasn't perfect, but my goodness, what a difference it is today. I barely knock on a door in Cambridge without someone telling me about problems they face either through working in the NHS being demoralised, because of course, not paid properly, recruitment problems, morale problems, or if their patients waiting. 23,000 people waiting more than 4 hours in A&E ambulance in the last couple of years. 23,000 waiting in pain. Very different in 2010. Many of you are familiar faces from that long struggle against the Older People's Services tendering campaign. What a nonsense. How much money was wasted on that? All because of the Lansley bill. And at second reading, when it could have been killed off, when the momentum was there, what happened? When we needed you, when we needed people to stand with us, the Liberal Democrats were there for Tories. You can never be forgiven. I will never forgive you for that. So, I'm passionate about this issue, but it's about the future. Labour's got a plan, whole person care, integration. It's the plan for the 21st century, just like the 20th century plan was the National Health Service in the first place. If you want that, it will only happen with Labour. I invite you to come with me tonight. Thank you.
Links refers to the great leaders debate that happened on television 2 weeks ago. So, is Sarah here? Would you be able to ask a question?
No.
Or would you like to have your voting mic? There's a mic.
Yeah, just talking to it.
Nicola Sturgeon wants to renationalise the NHS and says that her team of MPs will work with progressive allies to achieve this. Could each of the candidates explain whether they would be a progressive ally of the Assembly?
But for the easy ones, I think it's a really interesting question. Just one thing, because I noticed it happened at the leaders' debate as well. I was the only one of us to mention mental health. At the leaders' debate, Nick Clegg was the only one to mention mental health. Why is it that mental health is always the one that people don't bother about? It matters hugely. I hope there'll be some questions about it later. Because 1 in 4 people have a serious mental health condition. And it never, ever, ever gets raised. That really upsets me.
What about this question?
To come to the question, but because I think actually mental health does matter massively on this. I would like to see very substantial changes. That was the point of this NHS Amended Duties and Powers Bill. It was pushed by Labour MP Clyde Efford. We do actually work together across different parties. We work together, I spoke in favour of that. And I think that is the right way to go. We have to get to the right area. We'd actually like to go further, I think, than what Nicola Sturgeon was saying. So one of our ideas, and it will be in our manifesto when it comes out, is to say we've had this commissioner-provider split. And there's one body which asks for the work, and there's another body which does the work. And that links itself very much to the sort of privatised model. And we've said we would allow areas that want to get rid of that completely. To go back to the ways it was before the Tories introduced it and Labour accentuated it. To say local areas can break completely away from that approach. A fully national, public NHS without that split. I think that would make an absolutely huge difference. I should just pick up, and Daniel cites a lot of things. He, of course, forgets to cite the fact there are more people seen at A&E within 4 hours now than there were under the Labour government, about 9,000 more. And we're seeing many, many more treatments. I can give all the figures flat horse down, things like MRSA. But I just want to pick up quickly this point about the vote on the Lansley bill. I voted against it at third reading, I voted against it later, I voted against various amendments to it. Daniel's right about second reading. What he doesn't say is that at the time of the second reading, the British Medical Association were advising MPs to support it. The BMA position at that time was that it was a good thing for health in this country. So while I wish I'd changed my vote, getting it wrong because I listened to the medical experts is a sort of error I'd be prepared to make again. They changed their position later. I'm quite happy to have gone with their new advice.
Thank you very much.
Thank you very much, Sarah, for the question. In an ideal world, we would like to form a majority government in the Conservatives. But we have demonstrated, A, our ability to work with a coalition partner. We've also demonstrated that we're willing to listen, and particularly to the NHS. So, in a progressive sense, yes, we welcome ideas. The NHS faces challenges in terms of demand, efficiency and funding. And in that sense, the Conservatives are champions of the NHS, and we are committed to an NHS that is free at the point of delivery. So yes, we would be looking for ideas and looking to listen to the experts on these subjects. Thank you.
I think you're presupposing the outcome of an election, and we don't know what the election outcome is going to be. But what I can say to you is if Labour doesn't win Cambridge, it will be a Conservative government of one form or another. Now, it's absolutely true, because for Labour to be the largest party, we've got to win seats like Cambridge. So, the question is, if Labour can't get to a large enough number, what happens next? It's very clear to me that we're not going to work with the SNP. They're not progressive, they're Shaminians. They've got a current rate freeze. Actually, if you look at what's happening in the Scottish NHS, Scottish universities, all the rest of it, they used to be called the Tartan Tories. There's a reason for that, that's what they actually are. She talks a good talk, she talks left, but she acts right. And we're not about breaking up the union. So, what my guess is, if Labour doesn't get to a large enough number of seats, it will be very unstable, it will be bad for Britain, almost certainly be a second election, we'll all be back here in the autumn. It wouldn't be like that. And it probably won't resolve anything. So I'd say, get it right the first time, elect a Labour government, and then it's not a problem.
It's fascinating to hear that Conservatives and Labour both give you the same message of you've got to have us as the single governing power in government, otherwise it'll be chaos. I think we've grown out of that a little bit. I think the question's an excellent question, and I'm going to be the one person to say, absolutely, I would love to be in there in Parliament being one of Nicola Sturgeon's progressive allies. And it's clear that there is a kind of progressive orientation developing now between the SNP, Plaid Cymru, the Greens, some MPs in Labour and a few MPs in the Lib Dems. It's fascinating to think about what form that might take in a balanced Parliament. Now, thank you. And you mentioned renationalising the NHS. Well, yeah, absolutely. I'm the one candidate who can stand here and say, that's what I want to do. I'm in favour of the NHS reinstatement bill was drafted by my long-term friends and colleagues Peter Roddick and Alison Pollock and proposed by the brilliant Caroline Lucas. That is absolutely what's necessary. Nicola Sturgeon's right about it. I'd like to be right there with her on this. In terms of what Julian said about the purchaser-provider split, I completely agree, but did you notice the slip of the tongue Julian made when he said, and then if we allowed local areas to get rid of the purchaser-provider split, we could have a fully national, a fully public NHS again, because it wouldn't be a national health service if it was balkanised like that, with some parts keeping the purchaser-provider split and other parts not. What we need is a national health service that operates as a public service and that is fully reinstated. The effort bill does not do this. Let's get kind of technical here. Those of you who are aware of these issues will be aware that Alison Pollock and Peter Roddick have criticised the effort bill precisely because it does not bring back one single NHS with the Secretary of State having responsibility. For that, you have to have the NHS reinstatement bill. For that, you have to have Greens and Progressive allies in Parliament.
Can I just check that you can actually hear the speakers, because we do have a microphone for the speakers, which we're not using at the moment. So can you hear the speakers? Can I ask Sarah, any comments to make about the response to your question?
No, thank you for the four clear, helpful answers. Thank you.
Does anyone in the audience want to make any comment about this topic? Right, what happened?
Daniel, I wrote to you about the reinstatement bill and I haven't heard back from you yet. So I'd be interested to hear your views about that.
We're going to have it's going to be a full question on the reinstatement bill, so if I can just leave that right. The next question I'd like to pose is that posed by Alison Cowell. So, do you have a copy of your question? So, do you want to read out what you've written?
This is where I demonstrate I can't even read my own handwriting, but anyway. The coalition agreement signed in May 2010, a copy if anybody wants to see it afterwards, stated that we will stop the top-down reorganisations of the NHS. This was the Liberal Democrats and the Tories. And yet, they had very short memories because only 2 months later, along came the white paper that ushered in the largest top-down reorganisation that the NHS had ever seen, in the form of the Health and Social Care Act that was introduced in the House of Commons about 8 months after the election. And that's recently been described by one of the mainstream health policy think tanks, the King's Fund, as distracting and damaging. Now, with a record like that, why should we as voters trust the Liberal Democrat and Conservative promises on the NHS ever again?
Thank you very much, Alison, for your question. I can't stress this enough. We are committed to an NHS that is free at the point of delivery. And the King's Fund has also recognised that whilst our critics might talk about excessive privatisation within the NHS, we have delivered in terms of some of the lesser targets that were, or under Labour, there were very stringent targets in the NHS which took away people's attention from patient care and focused it on bureaucracy. So, for example, we've scrapped certain targets, but we've managed to achieve, according to the 5-year forward report, we've managed to achieve lower waiting times, we've managed to achieve shorter rates, protected funding. Patients' needs have changed, and we need to respond to that in terms of new technologies that are coming forward, and also the growth in population and the different types of illnesses and complex illnesses that people come forward with. So I believe there are challenges facing our NHS. It does come down to the 3 ideas of demand, efficiency and funding, and we will have to meet those.
Well, you can imagine what I'm likely to say, but I'll park that bit for a minute and actually talk about what the big problem with the Conservative promise was. And refusing to match the pledge to ring-fence health funding. He was absolutely right, because actually the problem has been caused by the huge cuts to local government and the effect that's had on social care. And by not seeing the two things together, that's where the problem started in a way. That's because these things, we can swap the rhetoric, but actually for those of us who are interested, there's a particular tragedy in Cambridgeshire in the sense that the older person services, that whole thing was stimulated in the first place by actually the curious position of the Community Services Trust, for those of you who will remember all this, when its status was uncertain. And that actually meant that far from integrating care in Cambridgeshire, we actually started by disintegrating it. And at the time, there was a possibility, Steve and I were talking about it at the time, we were worried that the Community Services Trust would end up being privatised. And actually, it was a better solution to go back to the County Council. But in terms of the overall picture, it was the wrong way to go. So the Conservatives, they were playing politics with the NHS the last elections. Cameron's big poster trying to detoxify the Conservative brand, you can trust me. Well, 5 years on, I think the public have made up their mind.
Yeah, well, another great question. What can I say? Well, a couple of things. Firstly, I thought Jamali's answer was a little bit surprising in that she didn't seem to engage with the question at all, as it was. Daniel's answer, I thought, was a lot better, and I very much agree with his point that we have to have a holistic vision when we're thinking about the health service. But if you want a holistic vision, then once again, your only choice is green. Because that's what the Greens are all about, right? All of our policies form an integrated whole, and that will be, by the way, a central theme in our manifesto launch tomorrow, which that's a tiny advert. We have a holistic vision that joins up transport policy, education policy, food policy, health policy. It's not enough for us to think about the NHS in isolation, right? We have to think about health and everything that conduces to health. Inequality is a crucial driver of ill health. So when Julian talks about mental health, for example, I agree very much with his remarks. Mental health is very, very important from the Green Party point of view. We believe, for example, in the concept of mental health emergency. We think emergency services for mental health should be taken just as seriously as emergency services for physical health. But if you're going to get serious about mental health, you have to tackle the cause of ill health. You have to be preventative. You have to be systemic in your thinking. You have to, for example, tackle inequality, which has risen under this government, also under the previous Labour government. And just finally, on that point, of course we can't trust the Tories on the NHS. Of course what the Lib Dems should have said when they saw the Lancet Bill coming was, hang on, this is a violation of the coalition agreement, which promised no top-down reorganisation of the NHS, and they should have said no to it. But isn't it rather extraordinary that in today's manifesto launch for the Labour Party, you have the incredible situation where the Conservatives are now promising to spend more on the NHS than Labour. So desperate is Ed Miliband to be respected by the right-wing press and by the business community, that he's promising a more stringent budget, a more stringent lock than even the Conservatives are. Of course you can't trust the Conservative policies, but are you really going to go down the Labour route either? There's a better way, and that's what I'm trying to bring to you this evening.
Rupert's right about a lot of things. Health inequality is very serious. There I happen to know about for various other reasons. And you're absolutely right. That is something we have to absolutely tackle. He's also right to criticise the Labour launch. I mean, it is astonishing that Labour are saying they won't put as much money as the NHS says it needs. They are promising to underfund it. You may or may not believe the Conservatives will put the money in, but they're saying they won't even try, which strikes me as worse. And local government cuts, I share the concern, Daniel. But one of the very few cuts that Ed Balls has identified is another 500 million on local government. You can't keep cutting it and complain that it's being cut. But to come to the questions, it's a really good question about the no top-down reorganisation pledge. And, frankly, I was told. When the proposals first came out, it was sold to me and to many others as being about giving GPs more control. And that's how it was sold. That's how GPs came to see me to say they supported. That's why the BMA supported it. And the BMA and all of us could then realise what was underneath it. It was incidentally the way Andrew Lansley sold it within the cabinet. He said, this isn't a big thing. We know now that's complete rubbish. But that's what he told people, and that's what people believed. And the BMA did have a big fuss. I mean, after the second reading, it was a few months later, there was a motion of no confidence in the chair of the BMA, and there was a motion at their conference to get them to change their position away from being in support. Astonishingly, even then, actually, the motion of no confidence was opposed, and the proposal they should oppose the bill was also defeated. Shockingly, it took a while for them to come round. So I do actually feel I'm quite annoyed about being misled and hence voting the wrong way. I accept it was an error. It was an error done for the right reasons, but I wish I hadn't done it, because we can do better. But the solution is not to have another top-down reorganisation and just go through the whole pain and anguish again. And that would really worry. That, by the way, is why we're suggesting this Commission of Provider Split be allowed in different areas, so that we don't say we're going to redo everything across the whole country. We let places do it when they want to. And that way, we will actually be able to know, is it better or is it not better for healthcare? That strikes me as a really important underlying question.
Thank you. Any comments about the reply to your question?
Thank you. I'd just like to make a couple of points. One is that 25 years of health service research showed that the Andrew Lansley bill was never going to work. It wasn't going to address the issues that it said it was going to address, and it was going to have that whole range of unforeseen and foreseen consequences attendant on it. So all those who are conned by it, I'm afraid, we're not looking at the readily available evidence. The other point I'd like to make is something that people keep bringing up, which is that the key point is that the service is free at the point of delivery. Now, with respect, that is not the only key point. That is necessary, but not sufficient. If what you're receiving free at the point of delivery is much, much less than you would previously have received, or is much less than you ought to receive in what is one of the wealthiest countries in the Western world, or is much less than you would receive if the services were developed in the manner to which we are all entitled, then it doesn't matter. But if you are getting free at the point of delivery what is a very, very tiny envelope, that is not the main point.
I can't at the moment support any of our main parties, and certainly don't support UKIP, which has, as it happens, despite Farage's animus against the health service, I had a copy of the UKIP candidate's healthcare candidate, which I would guess that Labour or anyone else would give their ID to have written. If you haven't seen it, I'll send you copies. I don't know whether anyone else saw in the last couple of weeks Nuffield Trust timeline of the NHS, so-called reports from the inception of the NHS to the present, and it was meant to be mapped against GDP, and I would suppose some figure for every decade of what had actually been spent, what percentage of GDP or whatever had been spent. I would like to see somebody volunteering from crack economists looking at that whole timeline and inquiring how much money that might have been spent on patient treatment and care had been wasted by those huge reforms which have been immensely costly, immensely incompetent, and I just didn't went on. And I spent a day the other day asking fairly free-form questions to get some answers about various aspects of health, and they didn't say Labour has the answer, the Greens have the answer, or whatever. I just compiled a list of things that I think it might be very useful for members of the audience to look at. I haven't finished typing them all up yet, and they're by no means comprehensive, but they do raise some issues, I think. And I think it's time we stop the tired references that continue despite the NHS collapsing visibly before our eyes, saying that it's the envy of the world. I have friends and relatives in France and Germany, and their health services, by several measures, are better than ours. And if you look at the OECD figures, I know that they're not straightforward example, Greece, which has practically no surviving health service, had a much higher number of doctors per head of population than we have, where training far too few doctors for our population, our growing population and our needs. Something like 50% of accepted entrants now are women, which is as it should be. But of course, they're more likely to bear the burden of childcare and care of elderly parents, and so on to work part-time and so on. And we're using, I have an Indian neighbour, the top schools of medicine in India devoted to Western medicine instead of the needs of their own population. And I think we would just say that enough is enough. We should be training more, and we've got on the money. Perhaps we should have a hypothecated graduated tax in addition to whatever can be found. But we're just watching the whole thing grow.
Thank you very much. Was there someone at the back who wanted to ask another comment?
No, it was just related to the funding issue. I mean, the candidates have all talked about, whether they believe each other's funding mechanisms and what amount of money. If actually you abolish the internal market, you would save an enormous amount of money. The administration of that market are up to 15% and rising, and have been estimated to be 30% by the time the Health and Social Care Act is fully implemented, with this wasteful commissioning and wasteful commissioning of private providers. Healthcare will be free at the point of service, but as somebody else has said, what service will you get for your money? It's just a scandal, the money that's been wasted that goes to private shareholders, which need not happen.
Moving on to a similar theme, George Thomas has submitted 4 questions, and it's actually the second question that I was wondering if she could ask now. And it starts, recent large tenders of clinical services.
Thank you. So my question is, recent large tenders of clinical services have encouraged providers to think differently about service delivery. However, the cost of these tenders, as we just heard, runs into millions of pounds. What I think is really important, given where we are now, is to understand the extent to which competition has, if at all, improved quality and efficiency, because this is what we're hearing very strongly. We heard this from Labour in the last Parliament, we're hearing that from Conservatives now. And I think it's important to assess whether that has been delivered, or in fact what has actually happened is that it's cost far more to run the tenders than the efficiencies that have been delivered through them.
I agree with you. And let's just get the history here. When Labour came into government in 1997, there was a huge problem with lack of capacity in the National Health Service, and a huge expectation. And by 2001, I remember that general election campaign very well. Virtually every doorstep, a bit like now, I went to in that campaign, there were people who had got problems with the National Health Service. There was huge pressure to up capacity. The debate within the Labour Party then was, do you use resources from the private sector to try and deal with that capacity gap, as well as pulling people from across the world? And at that time, that was a debate. Now, I remember having a heated argument with Alan Norman about that at the time, when I said, look, I will accept the argument that we use needed capacity, but I do not want this to become an integral part of our National Health Service. And that was a debate that ran through that Labour government. And there were people in the Labour government who were much too keen on those private sector market solutions, in my view, and the view of many others. By the end of the Labour government, with Andy Burnham, preferred provider status, which is basically the assumption that the NHS services will always be directly provided unless a provider can't do it, then you look at some alternatives. That was the position. First thing the coalition did when they came in was scrap that. That's a hugely important change. What I can tell you now is if Labour wins in 4 weeks' time, that will be reversed. The 2012 Health and Social Care Act will be repealed and preferred provider status will be reinstated. A huge change, really worth voting for.
So, let's be very clear about what happened under the last Labour government. For example, they brought in PFI and mortgaged all our futures. Absolutely appalling, unnecessary thing to do. Basically just a neoliberal accountancy trick which mortgaged all our futures. And let's be very clear what will happen if Labour gets into a majority government on May the 8th. They will not reinstate the NHS. The only circumstances under which they might reinstate the NHS is if there is a substantial progressive bloc in Parliament of SNP, Greens, Plaid, whoever, who want to actually reinstate the NHS. That's the only circumstances under which it may happen. And you know how you can achieve that in Cambridge. There's no SNP candidate standing here. The point made by the speaker, the questionnaire at the back there earlier, is absolutely right. There's a straight correlation between the amount of privatisation there's been incrementally in the NHS, under Thatcher, under Major, under Blair, under Brown, under this government, going up, and the increasing administrative costs in the NHS. That process can be put into reverse, and we are the only ones promising to put it into reverse. Finally, Julian says, yes, but if you do that, there'll be another top-down reorganisation. Well, what I say is, and I think that there's a lot of sympathy for this view in this room, is that what's happened under Andrew Lansley has not really been so much a reorganisation as a disorganisation, right? The NHS has become systematically disorganised, it started to be dismantled. Putting that into reverse is not a top-down reorganisation, it's a returning of the NHS to its founding principles. It's reorganising it when it's been disorganised.
I think it's a really interesting question about the costs, and Rupert is, of course, again, right to talk about PFI. PFI has savaged our healthcare system. It has sucked a vast amount of money. Something like £60 billion we're having to pay off, and at ridiculous rates. And it hits us quite bad here in Cambridgeshire, because Cambridgeshire has been used as an experimental ground by the last government, and to some extent by this government. So if you just look at some of the PFIs, we have the Peterborough PFI. Now, in Peterborough, that PFI, far too big, they don't need all of it. £336 million of work, total cost £2 billion. That's money we can't use. It's 18% of the costs of Peterborough Hospital, sucked away into PFI. We have the same thing in Hinchinbrook on a smaller scale, PFI sucking more money away. And it's really interesting that Daniel talks about this NHS preferred provider system. Because of course, that was the thing that was used to put Hinchinbrook out into the private sector. It was under Andy Burnham who did it. NHS preferred, but in fact, they reduced the shortlist, so not even any of the final three were NHS. It was 3 private sector-led bids: Serco, Circle, and Ramsay. That was what we actually saw. And while, yes, the cost of yes, it's because people like Angela's pulled out, because the Labour tendering system was too expensive. And Hinchinbrook, for example, the tendering under Labour cost more money than the older people services. That's why Edinburgh's pulled out, that's what they said publicly. So that was a complete disaster, and is what you saw under that Labour system. I'm actually really pleased that the older people's contract stayed within the NHS. I did everything I possibly could, and maybe 1 or 2 things I possibly shouldn't have done, to try to make sure that that was how it worked. Because I think that will provide much, much better care for older people in this area. We won't have that split between community services, mental health and physical health. I mean, older people constantly fall into cracks. So I think it's a brilliant question, and we should absolutely not have put so much money into PFI, not so much money into organisations, I forget how many PCT changes there were under Labour, but spend much more money on the public. It'll be tough enough even with the £8 billion we'll put in.
Thank you very much again for that question. I think the key things to remember are the number of doctors is actually up by 9,500, the number of nurses is up by 7,000, and the number of midwives is up by 2,200. It's still not enough. We need more. We need to train more. It's obviously bonkers if we are spending more money on the actual administration of a tender than we are on the contract that's eventually provided. So we will look at those things. But the key thing is, we have, in our autumn statement, we made a pledge of £2 billion per annum, which we have costed and we felt was deliverable. We have now had the chance to read and understand and see whether we can put in place the 8 billion per annum that the 5-year forward review is asking for. And that, on Sunday, we decided we could do. I've explained to you how we're going to fund it. And that brings us to the key issue. Why did all these PFIs come in the first place? It was shortage of resources, not enough money. It brings us back to the point on the economy. The Greens might tell you that money grows on trees and that they can fund everything. The Liberal Democrats, they can pledge 100 billion if they want to, because the reality is they aren't fielding enough candidates to form government on their own. And therefore, we did in the last election, that I used to be a Liberal Democrat, so
And you're wrong.
at the last election they did not field enough candidates to form a government. And therefore, they cannot form a government on their own. Statistics show they cannot form a government on their own. So they will have to join hands with someone. And then they'll say to you, oh, because of the coalition agreement we can't deliver on X promise or Y promise. What we are saying is putting forward a costed, we didn't just do it the day that the 5-year forward document was released. We've looked at it, we see the areas for improvement, and that will give us the resources that the NHS has called for so that we can deliver a national health service.
Can I just ask the Unions to make any comments about response to the question?
Thank you. The question was answered in part, but I really would like to pick up on something that Dan said. Labour's policy around taking the health fully back into public sector, I find, I have to say, really hypocritical. Under Labour, we saw policy called the Principles and Rules of Cooperation and Competition, which word for word pretty much was what went into the Health and Social Care Act. Labour set up the Cooperation and Competition Panel to enforce policy. That still exists, it just transferred into the regulator monitor. So, I do feel that Labour, they started what the Tories continued, but Labour started the policy, it was enforced, Hinchinbrook, the tender was run after that, under that policy, the older people's services that were started under that policy. What Conservatives have done is simply put it into law, and I think Labour's position is really quite hypocritical.
We've heard about the evils of PFI from at least 2 of the candidates. How come PFI contracts have been signed then? We've also heard from Shimali that they're there to save money the resources are available, and yet I believe public sector borrowing is about 3.5% in interest, and private sector borrowing is about 7.5%. So what planet does that actually save money? I suspect, I think as we all know, it's basically there to keep the borrowing off the accounts to stop the likes of the Daily Mail and the Telegraph shouting at them, basically. And if they just admit that, to be a bit honest, I think we all have a much better place to start from. PFI contracts, as far as I'm aware, are still being signed, and yet we're hearing lots of hand wringing about how awful they are. I think it's a pretty dubious position to be in, to be perfectly honest.
I just think it's rather sad that I seem to be the youngest person in the room, because I know about the NHS as much as anyone. My point for the panel is, I think this is a little bit like what's happening to the third floor of the library at the moment. It's being advertised and said as this great new scheme, and that it's going to bring a lot of new additional features to the library, but you're going to have to pay for them eventually. And then, after that, after 5 years, when they think you're not going to look, when you think they're not looking, they're going to start applying charges to certain parts of the service, so additional things. And then eventually, 10 years down the line, they'll make you start paying for it, perhaps even shorter. That can be
attributed to what's going on in the NHS right now. I mean, there are additional things that you can get that will make your stay in hospital much easier. Back in the, this was not what the NHS was set up to be like. In fact, quite the opposite. It was meant to encourage poor people, people that did not have the means to pay for health, to get a better quality of life and therefore live longer. Do the Conservatives want to go back to the age of people dying young? Is that why the Health and Social Care Act has been passed? And why did the Liberal Democrats help them along? I feel disappointed by the coalition, but I also feel disappointed that Labour put PFI in the first place. It's a very, very difficult question. Thank you.
I just got a question. Does anybody know, Mrs. Cambridge, as somebody will do, but my understanding is that PFI came in under the Conservatives under Major and not under Labour. So although Labour carried on, which was clearly not a helpful thing to do, and I utterly take Daniel's point that there were divisions within the Labour Party about whether to go down that PFI route or not. So my understanding is that Ed Miliband has completely backed away from New Labour in many of its stances, which I find encouraging. But I do think we should stop saying that PFI started under Labour if that's actually historically not accurate.
It was massively expanded under Labour. That's the reality.
Okay. I just wanted to raise this whole question of the £8 billion, because this is not what the health service requires. What the NHS England had said was that it needed £30 billion. But Simon Stevens was going to be able to cut maybe £22 million worth of cuts. Hurrah, as a result of which you only needed the £8 billion contribution, which is, now this 22 billion is on top of many more billions that have already been extracted from the NHS, since this government has been in power. So, I think let's forget about this 8 billion and how we're going to cost it. Let's get a health system that is properly funded and properly run and paid for by the taxpayers and not sold off to the private sector.
Yes, hello, I'm not an expert on the national health, but like everyone here, I'm sure that we all love our NHS and we wish it well. But this is a question really to all the candidates. Isn't it true that, we can push it, we can put it, we can argue about this and that, but at the end of the day, unless we have a strong, growing economy based on private jobs and private enterprise to raise the taxes, to pay for it, we will not have the money to support the national health.
One last question before we move on. Okay, so I'll be on the road. You have it on the side.
I had to change my question a bit because some of it's already been addressed. I was going to mention that what hasn't been talked about so much about the NHS is democracy, political democracy within the NHS. I think it should be nationalised economically, poor resources economically, so it's nationalised. But on a political level, democracy level, it should be more local sort of control. And the staff, the NHS staff should be running the hospitals. It should be run by the staff and the community it serves. So I just wanted to say what the candidates would say about that. I just want to have a little dig about Labour Party, by the way, and PFI as well, because 3 years ago at the Labour Party conference, there was a vote, unanimous vote almost, to vote for restricting PFI, yet this motion didn't come through into the Labour Party manifesto. So surely the National Executive Committee should be elected, democratically elected and accountable to what Labour Party conference should do. So there's also a bureaucracy within the Labour Party, not just the NHS, but in the Labour Party. There's democracy in the Labour Party, democracy in the NHS.
Yeah, so I think we had a few questions there. It's fascinating stuff. So Jamali asked, where's the money to come from? Greens don't think money grows on trees. You'll be hearing about where we think the money is going to come from tomorrow in our manifesto launch very, very briefly. It's things like scrapping Trident, bringing in a wealth tax, bringing in a land value tax. Let me say something. It's absolutely right what Jenny says when she says in the Simon Stevens plan, he's saying we can just about scrape by with 8 billion. What we really want is 30 billion. And I've spoken about this with Simon Stevens, who's someone I've known since we were at college together. He and I don't agree about these things entirely 100%, probably guess. But I think his plan is a good one within the confines of the current system, right? And that's the system which all of the other parties are accepting. But we don't accept it in these two fundamental respects. Firstly, as I've made extremely clear, we want to reinstate the NHS. And if you do that, you start to bring down the ever-rising admin costs, the ever-rising percentage of the money, which doesn't go into actual healthcare, but just into management and so on, right? And into waste, right? So when you do that, you start to save money hand over fist, and then you're not going to need all the 30 billion, right? Simon Stevens takes for granted that you're going to have existing or even worse structures in the NHS. We say no, right? Let's actually put that privatisation into reverse, and then you don't need so much money. And the other fundamental thing that we bring to the table is that in the Simon Stevens plan, there's some quite good stuff, gestures in the direction of prevention as a way of saving money for the NHS, right? But we say in the Green Party, no, we should go the whole hog, as I was talking about earlier. We need to take seriously policies to address inequality, to improve people's diets, to improve people's fitness, through cycling, walking. The whole thing fits together as a whole. And then you can have health, right, without having to spend an ever-rising amount of money on the NHS. Now, one of the questioners just now said, yes, but isn't there something good in that Ed Miliband is saying that we're not going to go along with all the New Labour stuff that we used to have, and Labour has turned over a new leaf. Well, I don't know if you saw the manifesto launch this morning. It certainly doesn't look that way from that. What that manifesto launch this morning was dedicated to saying was almost out New Labour and New Labour. So we're going to have a budget lock. We're basically not going to spend any money on anything, so that we convince the financial powers and the business press and so on that we're economically respectable. So I would say, judging from this morning's manifesto launch for Labour, they haven't turned over a new leaf at all. Yeah. Finally, on the point about democracy, I strongly agree, and I think it was very regrettable that the community health councils were abolished when they were. We need to return to something like that, a democratic way forward for the NHS.
Fascinating set of questions. I'll try to get through them all very quickly. On the library, I do agree, Lib Dem councillors have called it in, and if you want to hear about the library, 10 o'clock tomorrow morning at Shire Hall, I'll be there. Please come and join us. On other issues, the history of the NHS is fascinating. And when it was set up, it's really interesting to read some of the debates. It was believed that it would become cheaper every year to run it because people would be healthier. And unfortunately, that's not true. Because we're able to do so much more. Whereas previously, people with various conditions would just have died, we can now keep them alive. That's brilliant. But it does cost more and more money, and it's a real problem at the heart of the NHS. Is how do you keep that going? How do you deal with demographic growth, with health inflation, which is much higher than normal inflation, and with the fact that you can do more things? That leads to this massive pressure. You're absolutely right about 30 billion. And I think, but I've always been saying the 8 billion is the bare minimum. I think it'll be quite tough to hit even that. But at least we're going to try and get the 8 billion he says is absolutely needed. And there is a lot that you can save by organisational things. There's also a lot that you can save by prevention, in a route that's right on the For example, diagnosing diabetes earlier can massively save you costs from dialysis. There's lots and lots of ways of saving money if you can find things earlier. On active transport, there's a paper in the Lancet that finds if we could get to Dutch levels of walking and cycling, That's saved about 17 billion over, I think, 20 years. You know, these are large sums that we can save, and that's more effective. On the local democracy, yes, we should have it. I think it should be run by the public, not just the staff. I mean, I think staff should be well paid and motivated, but I wouldn't want to see that. I have to say that health and wellbeing boards have done some useful things in pushing ahead with things like public mental health. And I know in Cambridgeshire, the health and wellbeing board was extremely good when there was a proposed closure of the Life Works service, which I got quite involved in saving. And actually, that was able to bring people together to make a real difference there. So I think we can go much further on that. The PFI stuff, I think we've discussed today.
Okay. Thank you very much. Yes, a broad range of questions, and I will try and tackle some of the issues that those questions focused on. So prevention, I do agree with Rupert. I think there is a combination of factors that go towards other ways that we can deliver an NHS that is fit for purpose. So education, making sure people know this is how they should look after themselves, this is how they can be healthy, but also the early diagnosis and increasing awareness of illnesses so that people can almost, if you like, have a better understanding even before they go to their doctor. This is my problem, and be able to articulate that. We have a huge problem under Labour where there are patients, people have told me that they could only have 5 minutes appointment with their doctor. That's not enough time to communicate all your problems. It might be that you go in with one problem that has a series of complexities to it, and you can only talk about one symptom. That's not going to lead to the right diagnosis and will result in you going back to your doctor several times with all the different symptoms. We have made some achievements in the NHS, and I am very proud of those. So, for example, cancer survival rates are the highest ever. Deaths from heart disease are down by 40%. Operation waiting times nationally have been reduced to 18 weeks, and the NHS has been successful in responding to patient illnesses over the last 5 years. But we do need to do more in terms of frontline services and getting the community more involved. There's lots more voluntary organisations and charities also getting involved. We've committed with the Macmillan, you can laugh, but we've committed with Macmillan nurses, the efforts that they provide. There's a lot that has to be done in the NHS. Ultimately, the NHS is a big black hole. Because you can go in today with a stomach problem and the doctor will find that you actually have an underlying heart condition. Hippocratic oath, we have to treat that. That cannot be budgeted for in any sense of the word. So it's not just about money, but money is a huge part of the NHS.
PFI, we haven't quite finished on it, because I just need to set the record straight on one or two things. Yes, it did start in the mid-90s with the major government. I know that because I stood up at the 1995 Labour conference and opened it by slamming what I call the Pay Your Friends initiative. I remember Rodney Bicker started slapping me on the back and saying, well done. And at that time, I and others were warning about it. Now, when Labour came into government, the thing to remember is there have been virtually no new hospital building projects in the previous 20 years. The NHS estate was in a dreadful, dreadful state. Crumbling buildings, crumbling walls, appalling places. The issue for Labour, having seen what happened to previous Labour governments, was how to get that huge amount of capital investment that was needed and so urgent. And that was the debate that was going on. And actually, some of the PFIs worked. Quite a lot of them didn't work. For instance, the Adworks Treatment Centre is a PFI. It's one that works. People don't know that because it's not controversial. Hapworth, on its move to the Adworks site, that's a PFI. Now, you know, a lot of us are supporting that move, but it's a PFI. Now, the question you've got to ask yourself is, if the alternative is no build, is that what you want? And that was the choice a lot of us faced. Now, I would much have preferred a conventional route, but don't be under any illusion that all conventional procurement works. The guided busway is a conventionally procured project. Didn't work that well, did it? So the basic problem is big public sector projects are hard to do. The real problem came with the big fall in interest rates, which actually allowed the finance houses to make it pretty. What it really was about was that actually public sector negotiators were outwitted by the private sector on this time after time. So I'm giving you the account of what actually happened, but I'm not ashamed of the fact that we've got new hospitals across this country. And I'll tell you, I was talking to someone about this morning who works in the NHS, who was over here in an interview. She said, you're absolutely right. It transformed our working lives and conditions, and our patients are actually pleased to be treated in decent hospitals. And I don't think we should expect any less of people.
Can I please take questions from somebody else?
views on TTIP and tell us how their policy on the NHS fits in with that. I believe that Labour has said that TTIP is okay, but it will save the NHS from that. If it's bad, why do they need to save the NHS? And whether they think their party has actually compatible and coherent policies in regard to NHS and TTIP.
Can be, yes. No, I think it's a really interesting issue. So I was just trying to flick through, because I've got somewhere here, I've got some quotes from various people about TTIP. I think it's really important that TTIP does not affect the NHS, does not force privatisation on the NHS. The assurances that we've had from the Commission and various others, I was trying to find the exact quotes, say that it will be excluded clearly. I think that's absolutely essential. Our manifesto tomorrow will say very specifically that, beyond any doubt, that it should not be there, we won't allow it to be part of it, and so forth. And I think that's really important. I think TTIP could be a good thing. It could be a really bad thing. And at the moment, I don't know which one it is, because I haven't been able to see what it is. If it means standards get levelled up, that could be a good thing. I'm an internationalist, I'm very proud of that. If it means standards get levelled down, it's a bad thing. So we'll have to see what it looks like. The NHS should not be affected by it. ISDS, the Interstate Dispute Settlement system, is really alarming. It's been suspended from the talks which I've spoken out, being very pleased about that. It should be kicked out completely. And that would make a big difference about whether it ends up being a good thing or not. What I would say is when it's concluded, we don't really know when that will be. It might be 2016, it might be many, many years after that. It has to be agreed by the European Central bodies, but also by each national parliament. And if the document that comes up threatens our NHS, or means that our standards will have to be weakened to the worst in the US, or whatever it might be, then I wouldn't vote for it. And actually, I don't think many MPs of any party would vote for it. So my view on TTIP is very much there. We don't know what it is. It needs to be much more open. You, of course, can't be completely transparent about something we'll negotiate. I don't want the Americans to see every detail. But it has to be much, much more open so that we can be sure that it's overall a good thing. And that's something which will be very, very clear in our manifesto. And actually, we're talking about democracy. It came from amendments at the Lib Dem conference because it is a democratic process. That's where a lot of the ideas that I've been talking about come from. Suggestions from Lib Dem members. Very good ones.
Thank you very much. We have had assurances that TTIP does not encompass the NHS. And whether you believe them or not, the reality is those are the assurances. And I agree with Julian. There isn't a single member of Parliament who would want to go down the road of TTIP, of the NHS being included in TTIP. The problem we have with TTIP is fundamentally these discussions are opaque. So we don't know what's really going on there. But our interests as a country are best served by being at that negotiation table to find out what is going on there.
Absolute red line for Labour. I mean, for goodness sake, we are the party of the NHS. We're hardly going to be fighting for years and years and years for the NHS and then give it up the following day. So, absolute red line. Having said that, there are elements in the trade treaty which are worthwhile if they produce more jobs, more growth, more prosperity. We don't want to kick those out. And as Julian has said, if we can level standards up, whether it be environmental standards, labour standards, then we will do that. Absolutely. I think it's been a touch optimistic with the Americans in some cases. So I'm not sure I quite see that happening. But also to say, at the moment, the decision-making process is with Vince Cable's business secretary, and we hear some very worrying things about what he hasn't agreed. Vince kind of got legendary status, and then went on to privatise the post office, and of course triple tuition fees, so I wouldn't trust a word he says, frankly. And I think it's going to take a long time to negotiate this deal and get to an end. So at the moment, we continue negotiating, but absolute red line for Labour, we would not accept anything that threatens the NHS in any way.
The post office hasn't actually been privatised. Well, the post office is still publicly owned and franchised. I think we need a Royal Mail, which is actually a good thing. I think you know exactly what we're talking about. When you're talking about it, we're talking about not having a closure programme now later.
What a great question. Thank you so much. This is so crucial. Did you notice how incredibly similar those three answers were? They all basically said, we want TTIP, but don't worry, it's not going to affect the NHS. Now look, folks, if you haven't looked into this, please look into this. This is so important. This threatens our very democracy. Our democracy is under threat of being replaced by essentially corporate rule, international corporate rule. TTIP is the instrument. Of course it's going to level down standards. That's why they want it. That's why the big corporations want it.
They don't know what it's all about.
Yeah. It's very, very good concern. If TTIP does come in, right, be very concerned about the future of the NHS. Whatever they say about it now, I would urge you, if you haven't looked into this, read what Peter Roderick and Alison Pollock are saying about TTIP in relation to the NHS. Basically what they're saying is the promises about TTIP being given some kind of safety exclusion are not worth the paper that they are written on. Right? Look into it, what Peter Roderick in particular, who is an international constitutional lawyer of the highest order and a co-author of the NHS Reinstatement Act, is saying about TTIP. TTIP threatens the NHS, whatever assurances they give you. There is one party on this platform who is anti-TTIP, simply anti-TTIP, not we'll work for it with some nice TTIP. That party is the Green Party, and I would urge you to think about that very carefully on May the 7th. Thanks.
Any feedback on the topic of TTIP?
I'd just like to inform those in the panel who don't know that these trade agreements basically favour corporations at the expense of governments. And, you know, you should really educate yourself about what happens. These tobacco companies, you know, preventing states from, banning smoking. You know, this is what you end up with. It's nonsense. And really, it's very poor that you have absolutely no idea about this. There's a lot of people educate themselves, please.
I could just follow up just by saying, for those who want to educate yourselves, currently Philip Morris are busy suing the Uruguayan government because the Uruguayan government have put them on their 6-year package. They virtually cover them in warnings, and they're saying, oh, there's not enough of a brand sign on that. Now, that's clearly a serious issue. They could win because these things go to an arbitration, and the arbitration is dealt with by people who are quite often supporting the companies. Now, this is the sort of thing that's going to come about with TTIP. You really need to understand that. It's not, it's a really serious thing, and it'll damage the health service, and it'll damage all sorts of other things as well. And you really need to be aware of that. So, well done to you for opposing it completely.
Yeah, carrying on from that, I mean, it is disconcerting that there is a whole lot of information out there which goes into such detail about what is and is not in these trade agreements. And, if we could start from a position which is quite clear that this will have a terrible effect on the NHS, not even if it was excluded from TTIP. It does not cover the support services, it doesn't cover the pharmaceutical companies, it doesn't cover the suppliers, it doesn't, all of these things, all of these companies could still take the whole government to court for not honoring contracts or trying to not reinstate contracts after the contracts have run out, etc. It's just like a minefield. And the actual discussions are in secret. The way Julian talks about it, it's as if like a parliamentary bill, it's going to come to Parliament you'll have all the sections, you'll be able to discuss and pick and choose and say, no, we don't like this, we don't like it. That's not the way it's going to happen. In fact, at the European level, you can only vote yes or no. You know? So why are we even talking about this? Why would any government vote yes when it doesn't have any idea what is actually in it? And you're saying you have to wait, I mean, Julie was saying, you want to wait until you find out what's in it. You're not going to find out what's in it until you're in it, you know. And we're really strongly urging you to read the detailed, sort of analysis that's going on. I mean, one of the things that's come out is that the protections applying to services supplied in the exercise of governmental authority do not apply, which the NHS in theory might fall under. And part of the reason for that is to the creeping privatisation of the NHS. We already have so many privatised firms within the NHS that they would be in a position to challenge any changes, that we wanted to make if we didn't get the reinstatement bill in time to take it back into public hands. So, I'd like the gentleman over there. I mean, I think you really need to do your homework because this is so dangerous if this actually comes to pass.
Sorry, I've got one question, and the others have a private comment. My question is to the Conservatives.
This is on teaching, is it?
Sorry, teaching. Yes, I will do teaching. One of the things I turned up was House of Commons Hansard debate, 21st of October 2014, the oral answers to questions on teaching. And there is no transparency whatever. Caroline Lucas and one or two other people answered questions. Daniel Zappner at a meeting the other day said that the material was really not being presented to Parliament at all. They were totally useless.
There's one gentleman there, and I'll move on to another question.
I think in this situation you've got to follow the money. Who stands to benefit most from it? We've had a decent relationship with America for whatever years. Who's got the right? Why do we suddenly need this? Who's going to benefit most from this? What's in it for us? Very little, maybe.
I'd like to move on to two questions now relating to Cambridge services. The first one relates to conflict of interest, and this is been submitted by Steve Sweeney. I don't know whether you'd like to read a copy of your question or you want to...
Thanks. Circle's departure from Inchbrook Hospital followed an appalling CQC report on financial instability, meaning that they were unable to fulfil the commitments of their 10-year contract. Soon after that, both Circle and the Tories led calls for an investigation into the CQC report, making claims of political bias and blaming the Labour Party, the trade unions and the left. And they claim there's a conflict of interest. But campaign has been called for an inquiry to extend and include the following conflicts of interest. These are largely to do with the links between Circle and the government. Circle advisors moving to positions in government, advising David Cameron and Jeremy Hunt. Donations from hedge funds to the Tories. Tory MP Mark Simmons being paid 50 grand for a day a month working for Circle. The knighting of Paul Ruddock from Lansdowne Partners, which is a Circle hedge fund Tory loan, doesn't surprise me, and Circle being invited onto an official government trade trip to China. So bearing all this in mind, would the panel support calls for inquiry into how Circle were awarded the contract in the first place, and what measures would they put in place to avoid a repeat?
I actually like the question that's raised, because if there is, as there is amongst this audience, and forgive me for saying this, I know we all look at politicians and think, right, they're cynical, they're in it for themselves, that's why they go into politics to make money, they're not in the interest of this country. Well, that's not me. I've got a good job as a barrister, and I'm very proud of the work that I've done for the community, for people. I'm going into politics for one reason and one reason alone. I genuinely believe that I can do more than what I do already. So I hear what you say on TTIP. We have been assured that the NHS is outside of TTIP. And yes, we will read all these documents, but there's a lot of scaremongering that's going on as well out there. In respect to the gentleman's question, actually, if those are the issues, then we do need an inquiry into them, because ultimately, at the end of the day, no one is above the law, and genuinely, and I speak for this panel as well, I think genuinely all of us go into politics for the right reasons.
I think it's a real problem, Steve, and I think you're right to raise it. And I think it goes further than that, actually, because you remember with the Older Persons Project, we had exactly the same kind of conflict of interest with Virgin as well. And actually goes back to one of the points that was made earlier about the last Labour government. One of the problems, I think, actually, there are zealots at the Department of Health who have been determined to drive through a privatisation agenda, regardless of what the politicians were saying. I say that based on personal experience, when I had senior Labour politicians come to Unison events, and we said, what on earth is going on? What are you doing? And they said, well, what's the problem exactly? We'd show them documents, and they'd look appalled. Because the thing to remember is the number of politicians at Richmond House is maybe 3 or 4, with a couple of special advisors, and there's thousands of people working in the department. And I'm afraid the relationship between some parts of the private sector and government departments means that whoever's trying to control the whole thing doesn't always actually know what's going on. So it's a much more serious endemic problem, I would suggest to you, than just a question of some policy changes and alterations. The question of how we stop it happening again, I think is a really, really important one. And I'm not sure I know the answer straight off, but I'll happily discuss it with people. But essentially, it's too close, that relationship. And this revolving door of people going from government positions into private companies, and we've known this has been a problem for a long, long time. It's not just in the health sector. It's outrageous, frankly. And that's what causes the public to quite rightly be discomforted and anxious about this. And it's lousy for the politicians, who then find that, let's say, you can be saying things, you can be trying to drive through a policy, and find that your own people are supposedly supposed to be helping you, but sometimes doing something completely different. So it's a serious structure of government issue there.
So, important question, thank you. I've been involved in the campaign against privatisation of Hinchinbrook for 7 years. I think the issues you raise are very well taken. There probably should be some kind of inquiry. I'm fascinated to hear Daniel's kind of pleading of, oh well, we're not really in control, we politicians blaming it all on the civil service. Just like I was fascinated to hear Daniel 10 minutes ago defending PFI, defending this expensive way of mortgaging our futures and giving a vast amount of money to a tiny handful of the rich, and saying, well, there was no alternative. Of course there was an alternative. The alternative was public investment. And coming to the nub of your question, how can we be sure that it's not going to happen again? Well, you know what the answer is right by now. If we reinstate the NHS, it will never happen again.
I think it's a really good question as well, and I thought the way, particularly some of the Tories made, was absolutely disgraceful. And some of the personal attacks levelled on Maureen Donnelly, many of you will know. You may or may not agree with her. She's a Labour member, she's been involved heavily, but she is not the sort of person who would try to fiddle a CQC assessment for some political gain. You know, that is absolutely not what she would ever do. I mean, I was in touch with her after, I think it was a disgrace. You know, you should never be attacking the individual. You know, play the ball, fine. But I thought it was an absolute disgrace the way that worked. There were massive problems. It was just awful. In terms of how the contract would, I think part of the problem was that Circle were not a good option, Ramsey were not a good option, and Serco were not a good option. I don't think we'd all be sitting here saying, Serco run Hinchinbrook, that's fine then, that counts as the NHS, they're nice friendly team, I know they do, for instance, a few other problems, but So the solution is not to have tenders where we push them all out to the private sector. That's absolutely the wrong answer, and that was the problem with Hinchbrook. It was a question of, here are 3 cards, all of them were the wrong answer. To take the more fundamental question about the levels of corruption and alleged corruption, there are 2 things I would do. One is, I don't think MPs should be allowed to earn large amounts of money from second jobs. You know, they should not be allowed to earn 50,000 a year for doing anything like that. Just don't allow it. The next thing is gaps for ministers. So ministers can't just leave their office and work for the company that's just bidding. You know, much longer gaps. Many of them have similar controls to civil servants. In terms of donations, the way you tackle that is with really strict donation limits. So no one is allowed to give more than a certain amount in any year to anybody, full stop. So we've pushed for time and time again. I think the Greens have supported that. For some reason, Labour and the Conservatives are keener on people giving £1 million. I don't know if it's still true that everybody who's ever given £1 million to the Labour Party has got a peerage, but it certainly was a few years ago.
Would you like to come back on the answers?
Yeah, I think there was some interesting answers in there, but I think the crux of the question really was about corruption. Let's be frank about it. This is Hinchbrook Hospital has been a bit of a political football. It's my local hospital, and I've been one of those people that has been maligned in the local press. Around what's happened there. But I think the fundamental thing that it shows is that the private sector should have no role whatsoever to play within our National Health Service, and for any other hospital or service that's looking at going down the route of privatisation, it should be held up as an example of the disaster. But whilst the Tories are very keen to sort of make a political issue about the CQC, it's their hands that are all over this, and that's where the real conflict of interest lies, and it seems to be the same kind of thing all the time. But the answer, I think, is for no private sector involvement within the NHS, and that means not the NHS as the preferred provider, but the NHS as the only provider.